Hey ANPers, this is Dr. Jones checking in. This is ANP2 lecture test 6 video 8. This must be 8 because we just did 7. So 8, and we are towards the top of page 13. Video 8. Page 13 through we don't know yet. Oh, and I can put a timer on. Oh, I remembered. Hallelujah. Yay. Okay. Timer is going. Excellent. All right. Well, I am happy to see y'all back. Let's dig in. So we're talking about sexual intercourse. Great place to start. Sexual intercourse involves genitalia. Now, for the book's definition, because this is a section on reproduction, the part of sexual intercourse that causes reproduction is penile penetration of the vagina. And yes, I'm going to age restrict these videos. Not that kids shouldn't know, but I also make comments. So the part of sexual intercourse that causes pregnancy is ejaculation in the vagina. So there's that. Arousal happens before. Erection is when the erectile tissues in the penis and actually surrounding the vagina fill with blood. So men and women both have erectile tissue and they swell on arousal. Lubrication in the males, it's from the bulbourethral gland. In the female, it's from the greater vestibular gland. And these are fluids that are released prior to orgasm. Emission is in the male, and it's when the sperm and the seminal fluids travel through the reproductive tract. So when they enter the ejaculatory duct and the urethra. Ejaculation is when the semen leaves the body. And orgasm is in male with the ejaculation, in both males and females. It's a rhythmic contraction of the pelvic floor muscles, which are innervated by the pudendal nerve. P-U-D-D-E-N-D-A-L. D-A-L. Many things that are considered aphrodisiacs are actually pudendal nerve irritants, or like urinary bladder irritants, which is also innervated by the pudendal nerve. So not really an aphrodisiac, it just increases sensation in that nerve. So resolution is when your heart rate and blood pressure drop post-orgasm. Detumescence is the term for when the erection departs. Erectile dysfunction is inability to have an erection or maintain it. Sexually transmitted diseases, and I think these are in a different section now in the book. Yeah, these are on the next page now, so we'll come back to this part. Okay. Next, basal body temperature. I showed you that in the previous video. Contraception is when you're working to prevent a pregnancy. Infertility is defined as having unprotected heterosexual sex for 1 year and not getting pregnant. So that is considered abnormal if you have unprotected heterosexual sex for 1 year and don't wind up preggers. So I'm going to say this. If you're not trying to not get pregnant and you're having unprotected heterosexual sex, you are trying to get pregnant. Is that what you mean to be doing? Are you trying to get pregnant? If you're not trying to get pregnant, then you should be trying to not get pregnant. See how that works? If you're not doing anything to prevent pregnancies, you're trying to get pregnant. Should we say it that way? Yeah, that's a good way to say it. I like that. Amenorrhea, we talked about in a previous video, no menarche by age 16 or 6 months with no menses. We talked about low body weight can cause amenorrhea. Also, if the no menarche by 16, that happens often in intersex individuals who were assigned female at birth. And if you're looking for other ways other than just the basal body temp to keep track of your fertility, if you're trying to get pregnant or trying to not get pregnant and you find yourself unable to use some of the hormonal contraceptions, then this is the information that you're looking for. Take charge of your fertility. There's a 10th anniversary edition with updated information. So that's what you need to know. Okay. And then we have, yeah. Okay, going back on the next page. You go forward, I go back. Okay, on the next page we have sexually transmitted diseases, which are also called sexually transmitted infections, so STDs or STIs. These are diseases that are transmitted via bodily fluids, sexually transmitted bodily fluids. Pelvic inflammatory disease is chlamydia. It's a bacterial infection. It tends to be symptomless in men, but can cause infertility in women. So, AIDS is a sexually transmitted disease. It's the HIV virus, which when it becomes a disease is called AIDS, and that is transmitted through sex, through unprotected sexual activities. Have we talked about condoms? Protect your mucous membranes. Did we have that conversation? Where you use a condom until you've had them tested and you trust them? If you don't trust them, should you? Yeah, no. Okay, the Zika virus is another new to the area virus, which is sexually transmitted. And the thing with the Zika virus is if you're pregnant the first time you get it, it can harm the baby, specifically the development of the neural system. So if you're in your first trimester and you get the Zika virus, then that can cause anencephaly or hydrocephaly, or where there's less anencephaly is there's just not the brain, sometimes not even the back of the skull, and it's and microcephaly sometimes, and it's really kind of terrifying. Now, if you get Zika when you're not pregnant and then get pregnant, it does not affect future pregnancies. It's only when you first get Zika while you're pregnant. And the earlier in the pregnancy you get the Zika, the worse the effects are for the baby because the less developed they are at the time. And it's sexually transmitted. Condoms. COVID times. COVID is also sexually transmitted. So they took semen samples in male COVID patients, and a number of them had low sperm counts, like technically infertile at the time, and percentage, I think it was slightly less than 20%, had coronavirus, specifically the SARS-CoV-2, in the semen. So it is possible to transmit the coronavirus in sexual fluids. So wear condoms. Okay, if you're having heterosexual sex. Barrier method, no matter what you're doing or who you're doing it with. Protect yourself, protect your mucous membranes. You're protecting them too. All right, we talked about Zika virus, we talked about microcephaly. Let's talk about the comparison between the male and female external genitalia. Okay, so this is this chart right here. And I told you that we would write these down, and this is where we do that. And I have a bigger version here so that you can see. The penis and the clitoris come from the same embryological tissues, so they are the same. just in the presence or absence of testosterone, they develop differently. So these are the same tissues embryologically speaking. The corpora cavernosa in the male comes from the same tissue as the erectile tissue excuse me, in the female. Corpus spongiosum and vestibular bulbs share a common origin. The proximal shaft of the penis and the labia majora share a common origin. The spongy urethra and the vestibule, which isn't a term we learned, but the vestibule is this area between the labia majora. The bulbourethral glands and the greater vestibular glands, which are both glands of lubrication, share a common origin, and the scrotum and the labia majora share a common origin. And that makes sense because the proximal shaft of the penis, labia minora, don't have hair. The scrotum and the labia majora both do. Let's talk about the descent of the testes. All right. So this is the gubernaculum testis, which is typed in on your booklet, and it holds the testes in place while the body grows. So at 2 months, and this is 2 months post-conception, the 5 millimeter long gubernaculum testis connects the little bitty testis to the bottom of the scrotal sac. Now at 3 months, the body has gotten quite a bit bigger, and that 5 millimeters is the same length, but now it's not halfway up the body cavity. It's been pulled down, down at the bottom of the body cavity, and then at birth, that 5 millimeters is very short and has pulled the testis down into the scrotal sac. So that's the gubernaculum testis. The descent of the testes, the gubernaculum testis pulls the scrotum into, pulls the testis into the scrotum as the baby grows. And here you can see the development of the testes, and they go through the inguinal canals. I couldn't think of it. Through the inguinal canals about 7 months-ish, and are typically in the scrotal sac at birth. Cryptorchidism, that one, is undescended testes at birth. Orchiectomy, anytime you have ectomy, you have a surgical removal of, and the orchiectomy is a surgical removal of the undescended testes. If the testes remain in the body cavity past puberty, they have a higher rate of developing cancers. And so typically before puberty, maybe earlier, I don't know, I'm not a surgery kind of person, they are removed because of the high risk. They're non-functional in the body cavity because they're too hot to make sperm. And so they're non-functional, and so they are, because they are high cancer risk, simply removed. Andropause is the male climacteric, where men quit making the sex hormones. That happens around 60, 70-ish in men. Menopause happens 45 to 55-ish. Premature menopause is if you're no longer having menstrual cycles at the age of 40. So, how much time do we have left? 6 minutes. And that finished the chapter. So we're going to call it, did I have another picture for this chapter? Where do we go? Nope, that was the end of the picture for this chapter. Okay, so we are going to call it here. This has been A&P 2 Lecture Test 6, Video 8. We did page 13, well, the rest of page 13, and all of page 14. And we have finished off the repro, and we will come back with development, which will include genetics and Punnett squares, but babies first. Okay. So thank you as always for tuning in. The education must go on. Dun, dun, dun. It almost feels like a threat. Dr. Jones out. It's not.